Let's grab our red loop band. That's the red loop band in the YouniquelyFit kit. You're going to bring it around your outer thighs. We're going to rise up on our knees. And once we're on our knees, we'll hold the foam roller in line with the chest for thigh stretch. Inhale, prepare. Exhale, let your inner thighs pull you back. Roller comes overhead. Inhale, pause. Exhale, turn the head. 2, 3, 4. Inhale, center. Exhale, turn the head. 2, 3, 4. Inhale, center. 2 more times. Exhale, turn the head. 2, 3, 4. And center. Inhale, prepare. Lengthen the pelvis to the floor. Exhale, turn the head. 2, 3, 4. Inhale, pelvis reaches down as you come back up. Inhale, prepare. Shins heavy. If you're feeling the knees, brace your abs more. Use that neutral pelvis that we found somewhere between arching and rounding the back. Exhale, let your inner thighs pull you back. Inhale, pelvis pulls down. Exhale, you turn the head. 2, 3, 4. Inhale, pelvis pulls down. Exhale, you turn the head. 2, 3, 4. Again, inhale, pelvis pulls down. Exhale, you turn the head. 2, 3, 4. One more. Inhale, pelvis pulls down. Exhale, turn the head. 2, 3, 4. Inhale, lifting back upright. Let's come to lie on our foam roller, tailbone at the bottom, head at the top. In this position, I want you to find a neutral pelvis somewhere between arching and rounding the low back. Bring your arms into cactus. If at any time you feel the front of the thighs or your groin area, the hip flexors engaging, you can always tuck your pelvis under like a scared puppy and work with some flexion to turn them off and engage your abs more. Bringing those arms into cactus, softening your sternum, breastbone, and front ribs towards the back body, wrapping your shoulder blades around the roller, plugging your shoulders down your back, keeping your chin lifted and your gaze soft. Inhale, brace your abs, and exhale, bring the hands heavy to the floor. Now, hands can be heavy to the floor, or the elbows can dig into the floor with the forearms up. Find your neutral pelvis. Inhale, both legs into the air, hip distance apart if you have knee or back issues, together if not. Bring your non-dominant arm into cactus. You're going to pull that elbow to the side of the body as the opposite leg lowers. Let's try it. Inhale, prepare. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Inhale, lift. 2, 3, 4. Keep going. Lower. 2, 3, 4. And lift. 2, 3, 4. And lower. 2, 3, 4. And lift. 2, 3, 4. One more. Lower. 2, 3, 4. And lift. 2, 3, 4. Switching sides. No break. Take it to the other side. Here we go. Inhale, prepare. Lengthening the pelvis to the wall in front of you. Exhale to lower. 2, 3, 4. Inhale to lift. 2, 3, 4. Exhale to lower. 2, 3, 4. Inhale to lift. 2, 3, 4. Again, lowering. 2, 3, 4. Lifting. 2, 3, 4. Inhale, prepare. Lengthen your pelvis. Exhale, lower both feet to the ground, bringing your arms to cactus. Soften that sternum and breastbone inward, front ribs reaching for the back ribs, shoulder blades wrapping around the roller. Neutralize your pelvis. Bring your legs together for an extra challenge, taking the arms back up to cactus. Inhale, press the arms overhead, softening the sternum in as you do this. Exhale, bend the elbows. Inhale, press them overhead. And exhale, bend the elbows. And one more time, inhale, press overhead. And exhale, bend. Bringing the palms back by the hips or the elbows with the forearms up and palms facing in. Inhale, lengthen the pelvis, reaching the pelvis towards the wall in front of you as the legs come up, neutral. And make sure the legs are hip distance apart if you have knee or back issues, together if not. Externally rotate the legs at the hip sockets. Toes are nice and pointed. Let's we'll take our non-dominant arm up again into our chicken wing, pulling the elbow down as we lower the opposite leg of the arm that's lifted down. 2, 3, 4, lift it up. 2, 3, 4, lower down. 2, 3, 4, lifting up. 2, 3, 4, good. Lower. 2, 3, 4, and lift. 2, 3, 4, lower, 2, 3, 4, and lift, 2, 3, 4, 2 more, lower, 2, 3, 4, and lift, 2, hang in there. Last one, lower, 2, 3, 4, and lift, 2, 3, 4. Let's switch sides. Make sure that rotation's from the top of the hips, toes are pointed, switching arms. Inhale, prepare. Exhale to lower, 2, 3, 4. Inhale to lift, 2, 3, 4. Exhale to lower, 2, 3, 4. Inhale to lift, 2, 3, 4. Exhale to lower, 2, 3, 4. Inhale to lift, 2, 3, 4. Keep going and lower, 2, 3, 4, and lift, 2, 3, 4. One more, lower, 2, 3, 4, and lift, 2, 3, 4. Bringing both legs to the ground. Exhale. Slowly making your way off the roller. If you had sway back or flat back prior to pregnancy, you can bring the ball between the inner thighs. Just keep the band on for now, the red band around the thighs. We'll bring the shins onto the roller, hands on the floor. From here, we are just going to do some pulses in, driving from our thighs and our low abs. Try to keep your pelvis neutral. There's a tendency to round the low back. If you know for sure you had lordosis or kyphotic lordotic prior to pregnancy, rounding the low back here is fine. But if you did have sway back or flat back prior to pregnancy, I would keep your pelvis neutral for your back safety. Okay, so that's somewhere between arching and rounding. Inhale, prepare. Little mini pulses in. 2, 3, 4. Try and drive from the legs and abs, not from your upper body. Imagine those back ribs puffing into my hands, which are hovering above your shoulder blades. As you inhale and there's no movement, the pelvis is reaching to the wall behind you. As you exhale, you're lifting up on the muscles that stop your stream of pee. And remember, that's an internal lift. That Kegel action that I'm sure by now you're all too familiar with working on. So you inhale laterally, you pull the navel in towards the spine, you tug in and up on the muscles that stop your stream of pee, and as you exhale, it's audible, like you're fogging a mirror, ocean breath, Darth Vader-like sound. So keep that going. We inhale, 2, 3, 4, belly in, contract and pulse. 2, 3, 4, pause. Inhale, 2, 3, 4, belly in, and we pulse. 2, 3, 4. Keep it going. Inhale, 2, 3, 4. Contract, pulse. Exhale, 2, 3, 4. One more. Inhale, 2, 3, 4. Contract and exhale, pulse. 2, 3, 4. We'll bring our thighs off of the roller. Take a moment in a seated position to grab your red Theraband. That's the red Theraband, bringing the center of it around your feet and wrapping the ends around both hands with the knuckles, with it around your knuckles, thumbs on the outside. Will look like this. Come to a tall seated position. If you had sway back or flat back prior and you're certain of this, you can place the ball between the inner thighs on this set. Keep the band there no matter what. Sit up tall. Try to take the rounding out of the back by tipping the tailbone back like you're trying to arch it. Brace those lower abdominals. Hinging halfway back. Exhale. Rowing in for 4, 3, 2, 1. Inhale, pause. Lengthen your pelvis towards the ground. Exhale, turn the head right and left, right and left. Inhale, center, back up to a tall spine. Exhale, inner thighs pull you back. 4 rows. 2, 3, 4. Inhale, pause. Exhale, turn the head. 2, 3, 4. Inhale, center, all the way back up to that tall spine. Again, sitting up taller. Inner thighs pull you back. Row 4, 3, 2, 1. Inhale, pelvis reaches down. Exhale, you turn the head. 2, 3, 4. Again, inhale, all the way back up to a tall spine. And final set, hinging back on your exhale, rowing for 4, 3, 2, 1. Pausing, inhale, turning the head. 2, 3, 4. Inhale, center, back up to your tall spine. Set the red Theraband and your red loop band to the side. Coming to a comfortable seated position. Great job.